Chi-wise, I guess, for what people can do. Like I said, Tai Chi and Qigong are like some things that you can do. But the way, as you think about Tai Chi and Qigong, do work with the Qi and kind of harmonizing all of it. I guess when I talk about the flow of Qi, I said anger rises. So how you know, this is, I think, really helpful. It ascends Qi, so it can cause headaches, irritability, sleep disturbance, and injures your liver in that sense. And fear, like I said, it goes down. Like, I'm going to pee my pants, weak knees, fatigues, and then can injure your kidneys in that sense.
Welcome to the Wellness Amazon podcast, where we talk about everything body, mind, and spirit, health and wellness. No subject is taboo here, and we have fun peeling back all the layers. Let's do this. Welcome, everybody, to a new episode of the Wellness Amazon podcast. Today, also with a familiar face that you might know if you have been here from season 1, is Jessica, or Jess, my dear friend who wears many, many, many hats. I remember the first time you were on the show, it took us 5 minutes to even talk about what you do and who you are and what you can do and what you have learned in your life, because it's so much. So I'm just super glad you're on the show. Today, the hat you're going to wear is the hat of TCM, traditional Chinese medicine. So we're going to talk about, and you are an expert in that as well. Besides being a master in psychology and a veteran and a stunt woman, and I don't know, all the things that you do, voice acting. I mean, you're a very well-rounded multi-talent. And but yeah, today I'm super glad that you are going to share your expertise with us about traditional Chinese medicine. Welcome to the show.
Thank you. I'm so excited to be here. Every time someone asks me to share a little bit about it, because there is so much mystery. I'm happy whenever I get to do a workshop or a lecture somewhere, because like you said, I wear many hats, and it's so funny, expert, because I'm such a generalist in everything, because I'm just so curious. But I've been so passionate about this topic from day one when I went to school for it, and I still live by it and treat my family members and friends. So I'm always excited because it's a nice refresher for me to get back in. So thank you.
Yes. And it's always such a pleasure to talk to you about these things, because sometimes I learn something about herbs, or even from the Ayurvedic side. And then I ask you and you're like, oh yeah, this in traditional Chinese medicine is this. And it's like, okay, that tracks, So now I don't know, the more you know, the more versatile something can be used, or, sometimes you even have cautions maybe that nobody else is telling you about, which is really important.
Yeah.
So someone like you, who is, again, well-rounded, wears many hats, how did you get to even the idea of, oh, I'm going to learn traditional Chinese medicine?
There is actually a very plausible explanation. When I was in the military, I happened to work as a medical technician, even though that's not what I went to school for in the military. But I just happened to be working in that field, and I was like, man, the medical field's so cool. When I get out, maybe I want to do something in that field. But I knew medical technician, not really something get a degree in, plus doesn't pay well. And I knew I didn't want to be a nurse or a doctor, because I cannot see all the broken bones and all the blood is not a problem. I did phlebotomy, so drawing blood, come over here. I actually enjoy doing that. So I was researching while I was deployed. When I get back, I knew my contract was ending. What can I do with my 3 years of post 9/11 GI Bill? Because unlike the traditional one, this one's only 3 years because you get the monthly allowance. And then I remembered that one of the doctors at one of the centers that I worked, there was a girl, I thought she was battered. I was like, oh my God, she has bruises everywhere in her back. And turned out she had cupping done. And I had never heard about that back then. And then I was like, oh, there was this thing called Chinese medicine. And I saw, we were moving to Florida, that there was a school in Orlando, Florida College of Integrative Medicine, 3-year expedited program. So full time, 6 days a week with clinic, everything. And I was like, that's the one. And I fell in love with it. If you're a problem solver, that's the thing to do, and you're already super aware. And so I wrote my essay, did my application, and I was super stoked when I got in.
Wow. Amazing. And it's so you. It's so you. I am deployed and I'm already thinking about what to do next. That's you. I
That
love
is
it.
very
Um, when people hear traditional Chinese medicine, or you even tell them that you do that, right? What kind of misconceptions do you run into where you're like, "Whoa, stop right there. That's not what that is."
the typical what most people probably think, oh, it's like some voodoo thing, and you're just sticking people with needles. It probably hurts, and you see all of those movies where everything's always dramatized with everything like 1,000 needles on the body, and so most people are scared of the needles, and then just think like, how is that supposed to work? So the typical woo-woo magic kind of stuff, and
Yeah.
not at all.
Yeah. I usually hear from people that think about it because somebody told them that someone did it somewhere in their, acquaintances circle. It's like, "Oh, it's a bunch of really gross herbs you have to drink. It's
Mm,
disgusting." And I was like,
yeah.
"Really?" Okay.
That is not a lie, unfortunately. Even
Mhm.
myself trying to eat that bitter, it takes a certain kind of person to get through it, yep.
Mhm. Yeah, we've talked about mugwort tea before, and it's like, I mean, it's yeah, but the bitter stuff's the good stuff, so
It
ooh,
unfortunately is, but
yeah.
mugwort is good for so many things, as we're probably gonna talk about, when you don't have to drink it, so
Mhm. Yes. Oh my god, yes. We're definitely gonna talk about that. Okay, so what when we say traditional Chinese medicine, I mean, it's very self-explanatory, right? Tradition, so you automatically think, "Okay, it's probably old." Then Chinese, okay, coming from China. And then medicine, okay, when we talk about old Chinese medicine, something that's probably more natural and, whatever they did back then in the dynasties. Is that am I going in the right direction? Is that where it comes from?
Yeah, especially speaking about dynasties. Um, I'm sure like we learned a lot of the history and it's so difficult what they have all of the different years and which one really benefited from what. But yeah, it's way over 2,000, 2,500 years old. It dates way, 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 way back. And each of the dynasties really built on top of each other. And that's how it kind of grew, adding a lot of the things, it was the herbs, and they were adding the acupuncture, then the moxibustion with the mugwort, and then cupping and tuina, and it just over time became more rounded. But yeah, to its core, it's about 2,500 years old, so it's old.
Wow. Yeah. Which I mean it makes sense and actually is it's a beautiful thing that something so old has been, you know, carried over and taught to the next generation, the next so it doesn't get lost because we lose a lot of things and I wonder sometimes why we in the West are forgetting all of our good stuff so much, and the people in the East usually keep it alive.
I mean, it's very simple, just like with regular holistic things. Because just like you were saying, Ayurveda, for example, is there, or like even Western medicine, a lot of the things they used to do when they didn't just have 2 minutes, they would look at the stool and the blood and really look at all of the whole body and also talk about seasonal herbs and foods. So that was a thing that they shared commonly. So there's just so much more when it comes to yin yang energy, chi, and some of the things we're going to talk about. But to its core, the balance, combining the body, the mind, and nature was always there. But then over time, quicker and science and money and time is money. But like you said, with traditional Chinese medicine, it's so nice because in China, they actually do use it together as part of what they do. They have the Western medicine in the hospitals and the TCM that comes together. So it would be nice if we also in the Western world had the option to look at both just like they do.
Yeah. Well, it sounds like that this traditional medicine looks at the person as a whole and respects all of the parts of it and things that go into the disease or being unwell and yeah, that's a whole different podcast.
It really is, but, thinking about how they use it, so a lot of times they'll use, techniques if it's something really acute, they're like, "Let's just, patch it up with Western," and a lot of times you see it, that's most of the people that walk in the door, something chronic. I've tried everything.
Mhm.
And then, so a lot of the chronic things you see, a lot of TCM use. So there is really good use for both modern medicine, that's really quick. Would if you were to take it over a long time, could be harsh on your organs. But if you just take it short term, it's not so bad. But if we're looking
Yeah.
at long term things, or really ongoing forever, not just 3, 4 months, then it's nice to know that you have an option. Yeah.
Yeah, for sure. You just said something that I think we can dive into. You talked about yin, yang, qi, and all these things. What's that all about?
It's the typical what you hear, the light and the dark and the two opposing forces. So with everything, there's a balance. So there's something hot, there's something cold, there's something heavy, there's something light. And usually with everything, they say too much of one, even if it's good, it's still bad. So you're really looking at it from that way. And many things can be yin or yang, like lots of energy, like how men are yang because of the energy, the power. Yang is also morning, and yin is more feminine. It's more nocturnal, and it's more light in the way. So when we go through a lot of the pathology of things, and you're diagnosing and you say, oh, this is a yin deficiency, it's usually something, weaker than yang. It's usually things that really express more dramatic. So you have the yin and the yang. Then you of course have qi, which I
Mhm.
think when you talk about the woo, this is the one where most people will be like, well, what
Mhm.
is qi? And it's interesting because there's a part of the body that's called the coolie, and it's between like your skin and your muscles, and that's kind of where everything flows, and your chi kind of also flows through there. So it's really just a life force. If you think of neurology and how a lot of that sparks, you can't see that either. So if you want to see chi as something, and you want to think of it in Western terms, not one to one, but you can't really see how the signals go either. So for chi, you can kind of see that too. It's the life force. And a lot of it plays into it, how long you needle, for example, and cup, and the body parts, because it takes chi 15 minutes to run through the body. So if you have
Mhm.
somebody who has something with access, for example, you can do at least the 15, but sometimes more to get it through. But if somebody's really weak, you don't really want to drain more of it. So it might just be the 15. So you look uh, at one part of chi. There's more that we're gonna eventually talk about what that is in diagnosis to a chi deficiency, for example, versus a
Mhm.
stagnation. Then you have the elements. Of course, that's part of it. So you have water, fire, earth, wood, and metal, and each is paired with two organs, and
Mhm.
then also associated with seasons. So once you kind of have that bigger picture, more things will make sense. Then blood you have as its own, and then something called essence. And there's, especially when we talk about kidney things, a really big thing because a lot of your life force, your essence sits in there.
Mhm.
And also your essence is from two different parts. So you're born with 50% of your essence from what your parents gave you also. And then the rest is your diet and your lifestyle. So even if people are like, well, my parents had all this and you feel like I can't really overcome it. Well, that's 50%, but you have another 50%. So it's the yin and yang. You have the chi, the five elements, you have the blood, the mind, which sometimes you might hear the word shen. That's your mind, really like mental,
Mhm.
all of the things. And the heart. I think in the essence, it's a good place to start to not overwhelm. But principle wise, you have the yin yang, interior, exterior, hot, cold, deficient, and access, and that's what we
Mhm.
kind of look at.
Wow. Yeah.
It's a lot.
Well, a what I find funny is when and again, everybody is supposed to ask questions. You're absolutely okay with being skeptical about things, right? But a lot of times, every time we talk about energy meridians, and that can be chi, chakras, whatever, right? A lot of people are like, but they do believe in acupuncture because acupuncture has made a name over the years and has been, I don't know, maybe put a foot in the door of the more conventional medicine and people are open to it. Well, guess what? That's energy meridians. It's the
A
same thing.
massage too. You go to a massage and reflexology, and it's thousands of years of mapping the body, basically what it is, yeah.
Mhm. Yeah. Ah, this is fascinating. Well, so besides acupuncture, is there anything in the Western medicine that takes these meridians into account?
It's funny, I was thinking about that because, like I said, you do have it. I'm thinking of the reflexology in some sense, it's not quite as woo-woo, so they do know when you learn physical therapy and things that there are certain areas. One really big one that goes in the that people know a lot, people that like to go on cruise ships, for example, what do they buy? They buy that little band, right? And they
Yes.
put it here. What nobody knows is that is pericardium 6. That is on your pericardium meridian. So
Uh-huh.
pericardium around the heart, and it's one of those, and it flows right through there and is a really powerful point for nausea. So they're acknowledging that that point is really good for that, but doesn't get any credit. So you do see that, for example, as a really popular one where you
Mhm.
would see it. I was thinking, maybe not the meridian itself by like stomach, large intestine, and all the ones that are there, but how we explain how they work in Western medicine is a little bit that, for example, when you needle, what happens, you create a micro trauma.
Uh-huh.
So what happens is your brain says, alert, there's an injury there. So it sends the signals, the chi or the signals from your brain right to this point. So it wants to heal it. So you're really alerting to different areas that are there. And that micro trauma, then the blood flow goes there. You might feel pain relief. So that's a lot of times to the really basic core, if you want to explain it, that it finds the pathways. So that's how I guess I could also
Hmm.
acknowledge it.
Mhm. Okay. Did not know that. Interesting. Where did I hear that too? I think that was the same thing in the PRP episode where that actually came to the conclusion too about microdosing, was it lidocaine right under the skin and creating bubbles? And that is what the signal goes and just tells the nerve, "Hey, you need to stop sending pain signals so much." So it's just
Yeah.
I mean, it's just fascinating how the body works and how this, yes, is part of the Western medicine, but nobody talks about
Yeah,
it.
yeah, especially the whole body thing is not just the meridians, like I said, you're looking at so many things for women, especially things like your blood, like how's your flow and all of the things, or stools. Nobody really wants to talk about stools, but they can tell a lot.
Yep.
I can say a lot about like when somebody tells me about their stools. So
It's such a taboo. I always tell people, like, I am very self-conscious about what comes out of me. And we're talking about vision, we're talking about smell, we're talking about, you know, I mean, how is it coming? All of these things play a factor. And I don't know why it became such a taboo. It's like, oh, you look at your poop, you're weird. No, actually, I am aware of what's
yeah,
going on in my body. It's
you
not
don't need to
weird.
take a picture, but yeah, you can be really aware.
Unless your doctor asks you
Yes,
for a picture.
of course. But
Oh, yeah, I love it. Yeah, yeah, let's talk about diagnostics, I guess, in TCM. So I know you just said stool, things coming out of your body. What else do you look in a person? Because, you explained this really nicely how you look at it as a whole. So what
mhm.
else is like, I don't know, telltales?
There's quite a few things. So you can look on the ears, you can for certain spots for things. Sometimes you might have a really weird bump. You think it's a pimple in your ear, but then if you look at the map of the auricular acupuncture, then it might be a telltale of an organ where there's something wrong, or you might be catching a cold that's coming up and you can see it. Or if you have really red ears, you see with guys a lot of the high
Mhm.
blood pressure. So if I see a lot of red ears,
Uh-huh.
I can already tell. And some of that is like drops, like 2 drops of like letting that go can already relieve a lot of the blood pressure. So the ear, your eyes. You always say you can see the body and soul what the color, is of the eyes. The tongue is a really big one, but we do drink coffee and things like that, so sometimes it can be really tricky. You might think, "Oh my god, it's yellow and it's
Mhm.
heat," but it might just be the color of the coffee, and also you might not catch if it's really white coated, like coated, you're catching a cold, but you don't see it because of that. But, if you, like, stick out your tongue and then you on the side, you have, like, little, teeth marks, then probably your tongue is a little wide. It might affect your spleen, which has a lot to do with dampness and phlegm and diet and lots of other things. If you have cracks up front or really red or blister in your tongue, then heart and mental problems could be really big. So it's really divided into different parts there too. So the color of the tongue, the coating, the texture, I believe it's the tongue of a, I think, 5-year-old, 3 or 5-year-old is the natural color of what the tongue should be, and afterwards, it's always gonna be different because of,
Mhm.
your own conditions and your health. So you have the ears, you have the tongue as a really big one, the pulse, which, yeah, you really gotta be trained in. Like, if you're really good, you can tell someone is pregnant because you can feel another heartbeat on someone's pulse. But if it's really
Wow.
thready and weak or rolling, in there, then you know, oh, there's some deficiencies. If it's just really pounding hard, then there's a lot of access, so you can use that. And then, yeah, the stools and blood. And then telltale signs of just knowing, when do you wake up? Do you sleep through the night? And are you more hot or cold? Women, a lot of times, everything
Mhm.
normal, but hands and feet are cold. That
Mhm.
happens a lot. So you look at, yeah, the temperature, of all of that. So really the whole body. So you're scanning all that, asking all the questions, and then why are you here today, in a sense? And especially if it's chronic, it might really take a little bit to find the thing, and it could be something completely unexpected. You know, there are things, a really good example I like to say when I do these, somebody developed asthma and they never had it before, but they're
Mhm.
just like can't get rid of it, or this like nasty, like dry cough that's for no reason, just always pushing. And I'm asking, well, how long, have you had it? Well, about 3 years ago. Well, what happened 3 years ago? Someone I really cared about died, and your lungs are part of sadness as an emotion and grief.
Mhm.
So then I could, as another point, go up to the lung point and press, and it's probably really sensitive. And if we know that grief has been blocking you, creating asthma, really fast way to relieve that. So knowing if it's not something you've always had and you can really pinpoint it, most likely we can find out what it is with TCM.
Wow, that's fascinating. The issues in the tissues, right?
Mhm,
Mhm.
mhm.
So if let's say you diagnose someone, right? And obviously it's not Western medicine. I mean, most of us know what happens when we go to the doctor, right? What comes next? So what are like the modalities that TCM offers? Like maybe like the most common ones.
Well, most people will come in and then you get the Chinese diagnosis, and you'll probably get acupuncture at first. Like with most things, you come in a few times and then you start to do like the weekly, bi-weekly. And then it just depends. Do you need Moxibustion, which is the muck word again, that introduces the heat or the herbs into points, cupping, which especially with a lot of fascia things can be really good. Releasing a lot of stagnation. Then you get two different forms of that, and then tuina as a form of massage, or the gua sha,
Mhm.
with the little stone, um, the herbs, of course. But in TCM, when you find a practitioner, it is a little trickier because herbology is really another separate field. So some people might be licensed in traditional Chinese medicine that focuses on a lot of the technique things, and then they have a separate one for herbology. Because I'm going to show you, for people that are watching, there is this giant book, Materia Medica, and it is just like so much. And now they do make it easy. There are companies that also have like these little pebble pill forms. When you said to drink the bitter, there are
Mhm.
other ways. They have the little blue poppy, like, pebbles, for example, and you can take them just like
Oh.
other medicine. But it's a whole 'nother field. So I know we're talking about risks and safety and stuff later too, and that's one of the ones I definitely want to address. Um, and then there could be homework too. It could be that you have to do certain exercises as well. So there's many different things we'd look at depending on what it is.
Mhm, mhm. I love that. I think that's my favorite telltale when you go to someone and they do give you any kind of homework because it shows that, there is no magic pill. It's not in the sense of I go to you and you fix it for me when it might be something like you said that 50% of my own chi that I am responsible for. Radical self-responsibility. Well, I can help you, but you have to work with me, right? You have to do what I tell you to do. So I think there's huge value in that, and that shows also the integrity of TCM because yeah, you can't do it all. Oh, practitioner is gonna fix me.
And unfortunately, food therapy is a really big part, and a lot of people, that's where they
Mhm,
draw the line. If I say like 7 out of 10, I tell them they'll have to, for a little bit, stop drinking coffee. They're like, okay, I can't do that.
mhm,
And then that is part of it. So it is difficult because there might be things that you do have to give up in a sense, but food therapy is one of the biggest ones. And I mean, everywhere you see it, the way how everything is now processed foods, and even if you try to eat something organic, it might not really be organic. So trying to eat healthy, it makes it even trickier. You think you're getting maybe the right things, and you're wondering why is it not working. It could really just be a lot of that. So yeah. Mhm.
yeah, yeah. And this is a theme that comes up on the show a lot with funny thing, the most different people on here. It could be a doctor, it could be metaphysical. It's always the same message. You cannot biohack yourself out of a crappy lifestyle. It is, like you said, I go there, I go to a TCM practitioner and I get my bitter herbs that are totally disgusting, but I'm a good girl and I'm going to drink the tea and I'm going to do all the things. But if I keep ingesting the thing that you told me not to because it's actually hurting me, I can spend $500 on those herbs and it's not going to help because I keep feeding my body I don't want to call it poison, but something that it doesn't like or that it doesn't serve me, right?
100%. The main question when I get when people know that I studied it, and I'm like, yeah, let's like look at it. They're like, oh yeah, I have a migraine, or let's take something where we know it's different, like ADHD. Just and you're like, oh, everybody's so different. Well, it is. Everybody is different because in Western we like put it under one umbrella. Okay,
Mm,
that's that. But then if you divide it into all of the symptoms and body parts and other things that are in your body and the headaches and regions, then we have a totally different picture. You have like a liver qi
right.
stagnation, then you know it's a liver, it's a qi, and it's a stagnation, or it's a blood stagnation, it's a yin yang, it's an essence. So it could be all housed under the same thing. So you're like, well, I just have a headache, you take a Tylenol. Well, that's why your
Mhm.
headache's not really going away. You're just suppressing the symptoms. So you really have to dig deep. And sometimes you might have to also address the thing that isn't as important to you first because they're different layers. For example, you come in and there's something you actually want to work on, but now you have a cold. I can't work on that because we have to treat the cold first because otherwise that cold's going to go deeper and then you're going to get sicker. So there's a
Yeah.
lot of patience with yourself as well as you go through it. The longer you wait, the more difficult it just also is. Yeah.
Mhm. Mhm. Yeah, because you pile onto it.
Mhm.
Okay. So acupuncture. So you are trained in acupuncture.
Mhm. Yeah. So I didn't finish all the schooling. I went back to Germany and all of that, but I did do all of my internships and took all of the class, and I have my clean needle technique certificate and all of those things that go into it. Again, a lot of the safety stuff later. So yes, I know how to, and there is a lot to it with acupuncture.
Yeah, let's go. Let's talk about acupuncture. You talked a little bit about how it works, right? With the signaling, but I mean, let's go. Let's dive deep into it.
Okay, so you have the meridians, but then there are certain points that are better for certain things, like how we talked about the pericardium being right here. We know that's for nausea. But then there might be like one of the heart points that might be more to ease your mind. Or one point that draws you down if you need to ground, that's right up here also, that really pushes down again when for risks counter. Um, to that is if you're pregnant, again, it's one of those things in Western they know, but they can't explain it. Like when you shouldn't get a massage in your first trimester because you want to avoid a lot of those points that are really strong chi pushing. But when you needle, one of the risks when people might not have a good experience is a lot of doctors or practitioners might take a weekend workshop and they're like, oh, you needle. But there's so much to it. Depending on where you are and what you're trying to achieve, um, there are different angles and also how far you go in. So it could be that you go straight in for one. It could be that you're angling just 45 or really shallow. And then how far? Some of them, there might be a needle that's 6 inch because it goes through your glutes. If you have a really 2 inch needle, that's not going to hit the point at
Mhm.
all. So you really have to know what needle to use, what angle, and how deep you go to penetrate it to get the maximum effect. And then you have a protocol. So usually you wouldn't just stick one needle in. Around 5 is like a decent number to really get it flowing. And you want to create some sort of like cycle. You have maybe the hands and feet and up top. So location goes into it, the meridians, the organs, and things called ashi points. So ashi
Mhm.
points are pain points. So sometimes you might look at exactly where the pain is, and then you have it. Or if there are nodules, there's something called surrounding the dragons to really that really pushes everything in, and it can make the nodules get smaller and smaller. And over time, that we had one study, we had people that would come in that had maybe like tumors. There was one on the eye,
Uh-huh.
and really take pictures every time and really make it smaller. So you have the ashi, and then you have distal points. We're talking about how the ear, or if you have something on your elbow, you might have to needle on the knee. So there's so
Mhm.
many different areas. A really fun, quick one that usually gets the skeptics going is, oh man, I just like hurt my shoulder. Oh man, it's like just so uncomfortable. It's like, all right, let me come here. Right side. All right, show me your left leg. And then we'll go and hit the spots right down there, the bladder, stomach, the stomach points. And then you go in and I'm like, okay, now rotate it as I'm needling it. And as I'm going and you're going, the pain will go away. So that's
Wow.
a lot of the distal points, how they're connected as well. So
Yeah.
that's really interesting on that. And I guess the difference between the Western and the Eastern is also if the organs. So you have the heart, the small intestine, the bladder, the kidneys, pericardium, the triple burner, the gallbladder, liver, lungs, large intestine, stomach, and the spleen in there. Let's say somebody took their gallbladder out. Technically it's out,
Mm.
but energetically it's still there. Everything is still
Mhm.
connected. There
Mhm.
might be scar tissue that you're dealing with. But a lot of times you'll notice, wow, how intuitive your body is. It still works through it. The meridians are still flowing through that area. And fun fact for people that pierce their ears later in life. Like if you have the technical one for people that are watching, but if you have like the regular one, you got it early, you probably don't have any issues. But if you maybe as a teenager or later end up getting your ear pierced right here, this is usually where the eye sits.
Uh-huh.
So down here is like your head. It's like a fetus upside down is your ear. And when people get that, some of them will experience worse eyesight afterwards. So that's really interesting.
What?
Yeah.
No. No. Oh, we had, I mean, for people that don't know, I've worked with essential oils. I am not calling myself an aromatherapist, right? But I mean, been in that world and done classes and all that stuff since, 14 years. Yes, my youngest is 15, so 14 years. And we had one of those classes where we had someone there who was an expert in reflexology. And she said, "Yeah, let's do a fun little experiment. I'm going to put cinnamon oil, which is super hot. It's a super hot oil. It's like oregano. There's a couple of oils where you don't want to put them on your skin. They're going to burn." And she put cinnamon oil, just a drop, on the bottoms of our feet where the stomach is, the stomach point, but she didn't tell us what point she put it on. And she put it on and she said, "Tell me where in your body it gets really warm." And I was like, "Ooh, my stomach's getting, like, really hot. Like, I get, like, almost like I had a drink of a hot liquid tea or something, and, when you swallow it and you can tell where it goes down. And she said, "Yeah, I'm pushing this oil on your stomach point on your foot." And it was fascinating, and it was just a real quick it's like a party trick, right? But it just to prove you that no, they're definitely connected. So it's crazy.
Yeah, exactly. That's exactly that. And the same, like, especially women are really sensitive, like on the inside of their, like, by the calves. A lot of the spleen goes that way. And the spleen has a lot to do with the blood and things too. So we're a lot of
Mhm.
times sensitive with our deficiencies. So if you push a lot of those areas, they'll be really, really tender, especially for women, even if you have great diet and you work out and all of those things, just more tender. So there's a few of those where I'm always like, let me poke you here. And like you said, little party trick.
Yeah, yeah. I mean, it is really interesting, especially to do that with people that are really skeptical, just
Mhm.
so that you can feel it. Just everything in your body is connected. I mean, from your pinky toe all the way up to the top of your head, which makes sense. Where I mean, you're one entity, you know. Um, as a TCM practitioner, what are like the most common things you see that people go to you and say, "Fix me"?
Most of the people go for pain. That's why a lot of insurance companies will also now acknowledge, especially when people are in
Mm,
car accidents. A lot of insurance companies will actually pay for acupuncture with those kinds of things. So pain is a really big one because you can really manage pain very well. Especially like back pain is like a really common one, or like I said, a lot of like shoulder stuff and what am I thinking? Headaches. Headaches is just a big one just because there's so many different kinds, and once you kind of figure that out, that really, really helps too. So that's a biggie. But I mean, when for women, it might be a little different because I've also had my fair share of women that couldn't get pregnant, and to work
yeah.
on those kinds of things, I find those very interesting. So they're a lot of the again, no hope, nothing else helps, and they come. So
Yeah.
that's usually why you will see a lot of the same things because it's usually like, I'm in so much pain, I tried everything. I really want to get pregnant, I tried everything. So that's usually the things you'll see.
Yeah. Yeah. That's ooh, I always have a hard time with that. Um, and again, this is my personal opinion. Nobody come at me. This is not medical advice. This is my personal opinion. I do not believe ever that, oh, I have tried everything and nothing works. There is, because most people start with the conventional stuff. And it's like, but have you tried that like 3,000-year-old stuff that that we've done 3,000 years ago? Try that one.
And sometimes it's something so simple. You see a lot of women
Mhm.
that are really, really small, really, really skinny. Well, um, there's this thing called a hostile uterus. If you don't have a
Uh-huh.
uterus that's thriving, there's not the space. It's too cold, and cold doesn't necessarily mean like when we talk about, especially when you said cinnamon, for example, that's also in Chinese medicine a very hot herb. In that sense, if certain things that you eat, it doesn't have to be salad. People are like, "Well, I'm not just eating salad." Oh no, there are other things that are very cooling, and there's no warmth. So how is it going to survive? So sometimes like small things that
Mhm.
nobody else really thinks about. So even they change their diet or they're adding a little bit of body fat, which you will hear more and more in Western medicine, but there's so much more to it. Yeah.
Yeah. Yeah. How about menopause? Since
I
that's
was literally
always a
thinking that.
oh my god, that's such a hot cake on the show too. That's like where everybody's like, "Oh, I'm gonna listen to that one." Um, yeah. What's tell us the plethora of things we could do in TCM about menopause.
Well, it's the, like, fun part when I heard that for the first time. The same goes with, having periods. So they're like, "You do not have to have cramps. It's not something you also do not have to have hot flashes. That's not
Mhm.
something you have to have just because it's known." So again, knowing your body and how it flows, here again, you can work with diet and then certain points and figuring out why your chi is flowing in different directions or stuck or not getting somewhere. So that would be the one, okay, um, again, with menopause starting so different for so many women. Well, why? Also because everybody has something different going on and different lifestyles. So it's really one of those, there's no one size fits all when it comes to women's
Yeah.
health and all of that. So unfortunately, there's not one thing you could do because the one thing that works for someone really good could be the opposite of what you need.
Mhm.
So, for example, one is I'm like, oh, try to do the turmeric. I'm like, all right, I really would like inflammation and stuff. And then I realized how I'm aware. I was like, oh, I already have a lot of heat in my body. I That's not the right thing for me right now. So for other
Mhm.
people, it's great, but for me, doesn't work right now.
Yeah. Yeah. And I'm on the cooler side, so for me, it's wonderful when I take it, and it works too. It helps, like, immediate thing, but something I wanna really highlight what you just said, and this is because, good golly, I'm so passionate about this, and I wanna shout it off. I probably will end up on a rooftop at some point with a microphone. I can actually see this vision in my head. Um, Common doesn't mean normal.
Yeah.
One more time, common does not equal normal, because I absolutely loathe what you just said. "Oh, everybody's gonna get hot flashes. You're not gonna sleep. Your vagina is gonna dry up, and you're gonna pee yourself." No. No, 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 no,
Mhm.
my friend, no. That's not normal. That might be common because we have all common lifestyle issues because we live in this very stressful Western world, but there is cultures that don't even have the word hot flash in their language because they don't live like we live. And I love when you say, hey, it's complex. It's not the same for everybody, because it just shows again that you get seen as a whole person and as an individual who needs individual care.
But you can look out for signs. So the good thing is you might not have to necessarily run to a practitioner yourself. So knowing the way the elements work, reading your body, knowing we can talk about poop or things, for
Hmm.
example, and what to see, or how you feel, and some of the hot, cold, and those are like easy fixes. And then when you eat something or wake up at a certain time and then you change something, you immediately can see the result, and then we get a little dopamine rush because we fixed something all on our own. But yeah, if you don't know, and like I said, that one thing will work for someone else, but their root cause is different than yours or their lifestyle is different. So to really look at your body, so the best stool that you have is something shaped like a letter. Could be an I, could be an L, could be an S, kind of that. So perfect. And it should form, and you shouldn't really have to wipe. So when you wipe, there's nothing
Hmm.
or just barely something there. That would be like the perfect consistency. So now we also talk about smells. And that's like the best way to think of that is if it smells, think of hot garbage outside. Basically, what's happening on the inside. It smells because there's a lot of stuff happening in there. There's a lot of hot garbage. It either wasn't coming out or you have too much heat and it's all in there. And then if you're constipated, a lot of times it could either be, again, where you can't have one diagnosis just by saying, could be that there isn't a lot of fluid,
Uh-huh.
so then it's not moving, or a lot of heat that dries you up. So it could be dry or actual fluid related. So if you can't go and you want to go, so now you're thinking, well, do I have a lot of heat? Or do I need to make sure that I nourish myself and not just water in the sense, really just like your essence and fluid? And if it's really loose and it doesn't smell, it's a lot of cold. Add some warmth to it,
Hmm.
and the pebbles, which we will more likely, more people will probably not have one single letter. It'll probably be multiple. And that is a big sign of stress a lot of times because
Uh,
it's really that stagnation that you have, the chi. Um, uh, a fun one is, you know how they say, "Oh my god, I'm so nervous, I'm gonna pee or poop my pants." You know
mhm.
why that is? Because chi goes down when you like get like scared. Like, fear brings your chi down. Anger like rises. Worry scatters. So when you're like your chi is all scattered, it's all over the place. So that's why a little bit of nervous and then going to the bathroom, you're you're
Yeah.
all set. So looking at how you feel, what you eat, and your temperature, that will already tell you one thing that you could try out. So then you think, "Oh, maybe I'll add the turmeric because it's cold." Try it a few days, see how you feel with that.
Mhm.
Um, and things like when am I waking up at night? What time do I wake up? Most people have the most common between 1 and 3. It's the liver time. The liver is
Yeah.
associated with stress. So, waking up around that time, what can you do to eliminate that? Big one, what are you craving? We know that too, right? I'm sure you've had probably someone on that talks a lot about, with the chocolates, it's probably magnesium or
Mhm.
something. Some of the sugar, you should eat protein. And it's the same. A lot of like the sweet you want to kind of nourish, or like milk that makes damp or sour. A lot of things that you want to eat are kind of like your body screaming for
Mhm.
something else. So knowing what your cravings are, how you're sleeping, what your stool like, already like almost half of the thing solved.
Yep. Yep. And it's a beautiful thing because like you said, it's easy to do when you just awareness, you have awareness of your own body. And then everything you were talking about is very non-invasive,
Yep.
and just uh, it's funny how people end up with you in the TCM world after they have tried everything else when actually it should be the opposite, right? We should do these gentle ways first and then go to the hard stuff later. But yeah, here we
And
are.
there's some things that are like surface level, like especially self care. So this is a really fun one for us women, for example. Cupping, moving cupping, especially if you have cellulite on your legs, a lot of times if you have a moving cupping that you do, especially if it has like the special oils and stuff that kind of nourish like the blood, it'll really pull on that fascia. It'll really like relieve a lot of the muscles. It gets blood flowing, activates a lot of the collagen and all of the things goes there. But all right, you do it, and then just like with everything else, it'll come back if nothing else kind of changes. So um, there is, aesthetically so many things you can do. But for example, if you're looking, I have this stupid thing right here in the middle, the brow lines. I'm always just like squeezing and everything's so serious. And if you see me in public and I'm not actively smiling, you probably think I'm really mean. And there are things that I can do. There is facial acupuncture, that is a thing, for fine
No.
lines and things too, but also that will relax this one. This is one that you do, and this is also one of the most um, mindful kind of points for relaxation. So it comes together. What is also here? The third eye. So you got everything kind of
Mhm.
here. But what does that mean? So you have this right here, and then it's everything tense, and the muscle is tense. And then you're like, okay, the liver. Liver is stress. So I have a lot of stress, and stress is causing just more tension here. So I can keep on massaging and keep on doing this stuff, but this is not going to go away unless I fix
Yeah.
some of the things around it. So you can say, oh, I tried all that, but that doesn't work. Well, again, it was surface level, the easy things you can see on TikTok or here, and you're like, "Oh, I'm gonna start massaging this area and tapping it," and I get the needling, but it'll come back if you don't fix the
Yeah.
underneath.
Exactly. If your default is this face, it's I mean, it's just a muscle movement. It's always yeah, like you said, it's almost like ironing it out and then you sit on it. Like it's just
Yep,
sorry, you gotta iron it again, you
exactly.
know?
That's a good way to put it.
Oh, I love it. You touched on it earlier a little bit, I think, and let's dive deep. So, seasonal health, because this is you mentioned it before too. Somebody doesn't have asthma their entire life, and out of a sudden they do. I know people that haven't had allergies their entire life, and out of a sudden they get allergies, right? Um, how is this being looked at in traditional Chinese medicine?
Yeah, it's funny because you have that just like knowing there's an access of something and how your body reacts. So, you can go the route if it is like a sinus thing that you have then with the allergies to really clear them out. So it might just be a lot of stagnation that then will be caused. You got like the three, you got the eyes, the nose, the throat, and all of it. So you can actually really work on getting the sinuses clear, which a lot of it you can again do with a lot of a little bit of gua sha and some stuff too. Looking at that, if it is some underlying thing, it might be herbs that you're gonna do. But I mean, if the pollen is out there and you never had an issue with oak, but here the oak trees in Florida are just extreme, and our areas here are one of the worst. So you might have where you lived before not had an issue, but now you're experiencing an environment that your body isn't used to. That's why a lot of people will say in other um, holistic medicines to eat the local honey,
Mhm.
trying to get used to the pollen. So you're really introducing something that your body wasn't used to. So yeah, looking at it, is it some of the symptoms that might just have to clear and then underlying an allergy? Or if you all of a sudden were to develop something about milk, then yeah, we would, for example, have to look at that. What is going on, why you have a food allergy that you didn't have before. So, yeah,
Mhm.
then we're going again to the flavors and the meridians and the symptoms of it.
Yeah. How many times do you see this in this? Because again, we're talking about looking at the entire person as a whole, that there is an underlying issue of more mental stuff going on. So stress, anxiety, depression, all of that stuff.
Yeah, it's big because the Shen that we're talking about, the mind.
Uh-huh.
Even myself, like you said at the beginning, I do a lot. So I looked at my tongue recently and I was like, ooh, there are like a little bit of cracks that are moving a little further. So you have the heart and the Shen. They're really close to each other. So the heart and the mind. Um, so if you excessively worry or stress about things, you're weakening your organs. And when it's like with a car, if you don't change the oil, you just keep pouring over it, but you're not actually getting the oil changed, then eventually the engine's going to give out, and then the engine gives out, and this. And it's that same ripple effect that happens with the organs that go together.
Mhm.
So, in that sense, you look at what is the problem that I have, and how do I fix it?
Yeah. Yeah. Yeah, I imagine that this is for so many things the underlying issue, especially stress. People are just keep pushing and pushing.
Well, it's also a world of if we look at it, a lot of people are going back to the basics. So first of all, we're going back to whole foods because
Mhm.
diet, like I said, is a really big thing. Then time. If we have our screens all the time, we're constantly just exposed to so much information we can't take in and a lot of negativity that comes in. And we're just going from one thing to another and we don't have enough time. We're not grounded. So a lot of people will be like, well, like for me too, like meditation isn't necessarily something that works for me, but maybe there are some points you can use. Or I used to never know this, but intuitively I lay on the ground.
Mhm.
And that is a part of grounding. So if everything really pulls up and you stress and goes into your mind and your Shen and it gets clouded, really pulling down and grounding yourself, building roots helps a lot with that. Overwhelm with anxiety, a lot of it is it's just so overwhelming with things and overstimulation. So finding a good balance and what happiness means to you, especially when we talk about depression and things. Why are we depressed? Maybe you don't even know, then we really got to dig deeper. Again, then we're looking at the organs too, and your lungs and your composition and everything.
Yeah.
But it's a
Yeah.
big one, yeah. Mental health, that's why they always say the all the, psychosomatic things. Those are, of course, the things you get, "Oh, this is psychosomatic, we can't find anything wrong. We took blood work, we did CT scan, X-rays, it's psychosomatic." And,
Mhm.
that's when we look at the body trying to figure it out.
Yeah. Well, and now there are studies coming out that actually so they call the gut the second brain and the heart is now the third brain because they figured that the heart does their its own signaling with the brain disconnected from any other organ. So it's yeah, I mean, if you have an issue with the heart, why not look at the organ?
Yeah,
Yeah.
yeah, yeah. And we only just hear the regular things. You think of the heart as in just cardio and moving
Mhm.
and exercise and all that stuff, but there's so much like heartbreak and how that makes you feel, and when you're happy, how that makes you feel, when you have energy. So there is a lot that plays into that. That's why some of the the things you might not want to eat are bitter, but we're so used to everything. You want everything that's good and nice, but you're not willing to think about the things that come with it. Like sometimes you just gotta eat bitter, and literally in that sense,
Mhm.
to
Mhm.
kind of calm. There you got all that sweet. We gotta get the bitter a little bit into to calm the mind.
Yeah. What did I say? Bitter for the liver?
Yeah, that too.
Yeah.
That was actually, one of the things in class. They're like, "The Germans have figured it out," and then they, like, pointed at me. I was like, "Oh, was I paying attention in class? What Germans?" And they're like, "They have the saying, isn't it something you say? A lice, walked over your liver,
Mhm.
ist dir deine Laus über die Leber gelaufen?" And it
Mhm.
really is, like, something, like, going over your liver, bothering, irritating you. Because what are you like? You're very irritable at that sense. So it really shows how they weren't around. They weren't in China when this happened, but they already put 2 and 2 together. Um, and now also think about medications you're taking. So if a lot of the things are affected by our liver and our kidneys, which are really
Mhm.
important, and a lot of it the heart, um, where is a lot of the stuff processed? A lot of it through the liver or kidneys, depending on which of the medications you take. So TCM and another good combination is also good for people when you take the medication and you really want to make sure the side effects of insomnia that you have from taking some of them, or really the weaknesses that you have there, to help with that, which a lot of it could be also herbal or just being aware, clearing the chi and stagnations and stuff like that, building it up.
Yeah. So you at least have one natural thing for the side effects of a non-natural thing versus taking another non-natural thing for the thing that the other thing,
Yeah, I had
the whole
looked up
chain
one
reaction.
specifically because I was, really curious about it. I hadn't heard about, like, we would get people in the clinic that, had Parkinson's, or, people that deal with, pain management of their, chemotherapy or things, and then we had people that are autistic that come in, but I was looking specifically at a lot of the ADHD stuff, and it was so interesting because it was talking about, well, yeah, that one, I'm pretty sure that one is one of those that goes through the kidneys, but then again, like, what are the symptoms that somebody naturally has when they're not medicated? Are you, like, restless? Is that what it is? Do you need to be grounded? Or, a lot of the anxiety, again, then
Mhm.
we have the heart and the shen. So how are you calming the mind and then grounding yourself and really putting that in? So now the medicine helps connect all of those little things in the brain. You take the Adderall, so it helps that, but it might come with other things, like, yeah, some people have insomnia, or you don't drink enough water. You gotta really make sure, because it
Yeah.
goes through the kidneys. So, I find it really interesting to say, okay, this is something that I'm always taking, and there are just some things how my body reacts to it. How can I help? And yeah,
Mhm.
that's yeah. So if you're taking any kind of SSRIs for like depression or things, and then notice maybe your libido is, like, really low, when you can strengthen a lot of the things that then go with that. So you don't wanna stop taking it because it might really help you, but you do want to make sure that your sex life doesn't go away. Then maybe libido is something that you come see somebody for TCM.
Yeah, so that brings me to another point, which also you mentioned the word safety a couple of times. So let's say somebody listens to this today and says, "Oh, I want to try TCM." So are there safety precautions? Are there anything you could speak to? You should look for that in a practitioner.
Yeah, so as I briefly mentioned, when your doctor is like, "Oh, yeah, we can do some TCM." I took a weekend workshop. Again,
Oh,
the biggest thing is they might know certain points that, like, real quick, yeah, like, "Oh, okay, here, put some down, or here, a couple of those," but they don't know the meridians. They don't know, again, the stimulation, some of the other things. So really making sure that, and sometimes you can also see on people's websites what they specialize in. So somebody might specialize a lot in herbology. So I have a good friend, Kenneth, like, he does a lot of that. And then there are some people that focus on women's health specifically, so they really dive deeper, just like any doctor, when you go to and you're like, we're not kind of on the same vibe, because somebody always has something they're really extra passionate about, or they'll see the signs, because there's 10 things, could be 20,000 different things. 10 symptoms could be 20,000 things, but this is the one thing this doctor will always say. So knowing that they are licensed, and what field, maybe if you have something specific, and you'll know when you go to them, they've also, like I said, they've done the clean needle technique, so everything's safe and clean in the sense. Because yeah, in other countries it might have different protocols, but you'll, for example, see they'll a lot of the needles will be in, like, sleeves, so we don't really
Mhm.
touch the end of it. So that's like one of those clean needle technique things. Um, and yeah, just if they care about you, I think that's something that you just feel. You might just have to try out. But it's not something you can say, I didn't feel it on the first time, so I'm going to give up, because it isn't something that's instant. You might feel the relaxation part a lot of times will be a big part because we don't take time. So sometimes it might just be that you never, without your phone, lay somewhere for 20 minutes. So when you get
Mhm.
that first acupuncture treatment, you just lay there for 20 minutes and just silence, whether I do something, but other things might just take time. So just give it a chance and really like listen to, and they're like, hey, the first time might be 2, 3 times a week, because at
Mhm.
the beginning you really have to target it. And then like I said, the contraindications, but all of the trained ones will know. Like for example, if you're um pregnant and you really want to be super careful, first trimester is always like so difficult. They'll just know which areas are good, because you can get acupuncture and have other treatments, some things that actually enhance or nourish, but it's just really good
Mhm.
to know that. So that for me is like the biggest one.
Yeah. I would add, just out of personal experience, also don't shy away to be very communicative with your practitioner because they are so in tune with what you need and energy and all of these things. For example, I have had acupuncture done and I had ear seeds done, and those are just like the magnetic ones that are not really, there's no needle involved. And I thought, oh, I have done needles in my body, ear seeds, this is going to be like a piece of cake, right? Oh, no, no. It was combined with the meditation. It was too intense for me. I said, "I am fine with the needle in my hand, but I want you to take that frickin' ear seed out right now because my ears are buzzing and I have all this
Yeah.
energy on my ears, and it was too much." So it's just like you said, everybody is different and reacts different to different things. Um,
That
and
is a really big one. So ear seeds really is fun, because when you go, this is something that'll even work when you leave the clinic. So you get the acupuncture and get them, they stay on when you shower. They'll fall off when they're done, kind of, or after so and so many days. You can just take them off, but yeah, they can
Mhm.
hurt. You're supposed to also manipulate them, and that's again what shows you how of the different areas on the ear. The psychologist, neuropsychologist that I work with, we've worked on some of the things he had, and he'd had some ear seeds on for a few days before too. I went home with his ear seeds. They're so nice because it's something you really take home and you
Yeah.
think like, how's that going to work? Well, a lot of them either, yeah, just the pressure, but a lot of the ear seeds actually have herbs in them too. So like little round balls in the little thingies, and they'll kind of keep working on their ear seeds. Yes, they
Hmm.
can be very intense if it's a very tender spot, but they're so good.
Yeah. It was very surprising to me that that was the one where I went, "This too much buzzing." So, very weird. When you think back on your time of practicing, right? What was your favorite part, or what is your favorite memory?
My favorite, because, the actual legally practicing was in the student clinic, and everything else is with friends and family, which is still very rewarding. Um, but when you come in and you're trying to really solve this problem, they come in and they trust you, and you look at it and you kind of get this clear picture of, I think I know what's going on, but then also working together maybe with another practitioner that looks at things from another side, and you creating this protocol. Um, there was one case when all of the women in my class were all going either for women's health, and a lot of people were doing geriatric things. I was like, you know what? Nobody looks out for the men. I want to like try to like specialize in some of that,
Mhm.
and that was something. And I did get my first erectile dysfunction case that became my case study, and it was so wonderful because it really showed how many things went into it. It was a lot of mental things, mental blocks and pressure. Then, of course, also not using the muscle and the blood flow that was going in. So we were really working with breaking up some of those mental problems, being communicating more the needs and what's going on with the partner, needling, and this is not done right down there in that area. So
Right.
again, there are other areas that flow through it that are really good for the reproductive organs. And then, yeah, doing maybe some exercises to strengthen the muscles, and to hear when the couple ended up coming in, because he had been, I think, 20 years. I think his wife had died or something like that, and then he hadn't had anything for a really long time. Must have been, I think it was like 20 years, and they came in and they were so happy because they were able to,
Oh.
for the first time again, like, have, intercourse, and, it's so important. It's, like, always
Yeah.
underrated. I mean, all of us, the way life is, and, you just see the commercials all the time, like, "Oh, here's like a Viagra or something, or take that." You know what I mean? Just like you said with, "Oh, it's normal to have hot flashes, menopause or whatever." No, that
Mhm.
there are many things you don't have to have, and there is a lot of use it or lose it, so that can be something, but a lot of it can be blockage, utter blockage, not
Yeah.
just the blood. So that was a case where I was like, that really touched my heart because it was something that sounds so like, why is it important? But it was for their relationship, it was make or break kind of thing.
Yeah. Yeah. And it sounds like that was the safer route at this point too, because you did take care of like what you just said, blockages, and there's cardiovascular things going on and blood flow and all these things that, yeah, don't. This makes me very nervous that so many people dismiss that just because they're just taking the blue pill and not actually looking at the root cause on why this isn't working anymore. And it's so dangerous. So,
Yeah, and some people don't like how that feels either, and that was one of them. He was like, "Well, I don't like how that makes me feel when I take it." So, yeah,
mhm.
again, it's just a Band-Aid, but it doesn't actually, you know, help. It's actually just a side effect of the medication that it helps.
Yeah, yeah. And again, like you said, we do need Western medicine, but what everything you were talking about today, my end statement here, I love that TCM looks at root causes. It always looks at where are things coming from and how can we fix the root cause and not just slap a band-aid on it.
Yeah, couldn't have said it better. Exactly.
Yeah. Is there anything we haven't covered today that you would like to mention?
Oh, yeah, I guess in general, like, yeah, like, if for the self-care and advice, so listen and watch your body. Sudden onset of symptoms especially, really
Mm,
make sure you remember, like, what it was and that caused it and what you're eating, sleeping, and what activities you're doing, especially when trying something new. There's so much, in detail, but, chi-wise, I guess, for what people can do. Like I said, for me, a lot of times it's not, but tai chi and qigong are like some things
mhm,
that you can do. I like fast, like how people do yoga and stuff. I need fast. That doesn't work, but, the way as you think about Tai Chi and Qigong, do work with the Qi and kinda harmonizing all of it. So more and more people are aware of, the benefits of what that can do. So if you're somebody who can do slow, movements and, I guess when I talked about the flow of Qi, I said, anger rises. So how you know, this is, I think, really helpful. So it ascends qi, so it can cause headaches, irritability, sleep disturbance, and injures your liver in that sense. And fear, like I said, it goes down. Like I'm going to pee my pants, weak knees, fatigues, and then can injure your kidneys in that sense. So you have that going. Worry depletes kind of the chi and weakens your spleen. So that's a lot of indigestion, weight issues, ulcers that can be in there because the spleen and the stomach are a lot connected. So that's
mhm,
why you say when you worry and like especially you get like
mhm.
the stomach ulcers and stuff. So breaking that up, sadness disperses to chi. So again, lungs, you don't have that. You have the chest pain, pressure, the asthma, a lot of sighing. You'll hear some people, they'll sigh a lot. And then I'm like always thinking, oh, there's more to it. If somebody very frequently sighs. And then joy scatters chi. So if you have too much joy, you can have insomnia, heart palpitations, hysteria. And that again is the heart and the shen. So for me, a lot of times when I get excited late at night and I try to go to bed, both palpitations and insomnia will be that because my joy scatters my chi and I can't sleep. So looking at the organs, how the chi flows and what emotions go around it, I think it was one last part I wanted to dive in. Yep.
I love that. And I mean, we've all been there, right? We come home from a gathering, even if you're an introvert, but you had a good time. Let's just say you had a good time, you buzz, and you're like, "Oh, I can't go to bed. I can't go to bed." So, yeah. Um, I love qigong, and don't you do kung fu? Isn't that like a really fast version of Tai Chi?
Yeah,
Right?
that's why I was like, I like, doing kung fu, so we work with a lot of the same movements, but they're
Mhm.
just faster and 100% and qigong really, yeah, is another totally different story. So qigong is actually really pretty cool. I do find it I haven't done that in a long time, but yeah,
Yeah.
finding a way to balance that. That's why you will hear, for example, with what you said, you come home from somewhere, you're really excited, and you maybe won't
Mhm.
be able to sleep. The same with them being on your phone, because you have all that when people are like, "Go somewhere it's dark," just like some silence, and then
Mhm.
go back to bed. Just don't just lay in your bed with the excitement.
Yeah.
It doesn't get you anywhere. So kind of understanding your emotions and how that makes you feel, and if it's prolonged, how much of an effect it will have on your organs, and then trigger like a domino effect. And then you're like, "Whoa." Yeah,
Mhm.
that's how that mental part comes in again.
Yeah. I Qigong is the one thing that will take me completely out of my ADHD. It takes about 5 to 10 minutes, and then after that, there is nothing exists anymore, and I can actually focus for a couple of hours afterwards. It's pretty cool.
That's jujitsu for me.
Mhm. Yeah. Yeah. I mean, we've had an episode about how to turn off your overthinking brain with jujitsu because,
Mhm.
yeah, you can't overthink about other crap while somebody's trying to choke you. I'm sorry, you know?
100%. And once you're already out and then you're in that mindset, so whatever helps you get out of that mindset, any of these things that will pull you right out, qigong or yeah, jujitsu, and then don't go right back in. Habits,
Yeah.
habits.
Yeah. Yeah. I love it. Ah, wow, that was a ride. That was a lot of information today. And is there like good resources people can look at?
I think most of the things you find online are actually okay because you'll see the majority. Usually, if you look for the Meridian clock and it has the elements on it, so if you just want to have in like one source, it'll usually have like the yin yang in it, and it kind of has like the clock and then the organs and all of that. Um, you can find that, and sometimes you can find good food lists. I think nowadays
Uh-huh.
that might actually be really easy if you're just also looking for maybe creators or influencers, but creating a good food list what I haven't talked about, I kind of hinted on it. Salad, for example, it seems like that's something cold, but that's not really what we talk about. Let's say you eat a watermelon. You might put it in the fridge and think that's cold, but the watermelon technically doesn't have to go in the fridge because watermelon is the coldest herb before we go to rocks in Chinese medicine. So if you
Mm.
want to do an experiment, I have by accident done this before. I ate tons of watermelon every day and I got so cold and nothing would warm me up because I was eating a lot of watermelon. Same with like
Mm.
cayenne and chili isn't the same. So cayenne, cinnamon, ginger, turmeric, all the things that warm you. So looking for warming, cooling, neutral foods is really good to find online. So, to really work with how you feel, and what can help with some of the symptoms, emotions, yeah, food lists and, the meridian clock. I think they're good
Mhm.
resources.
Cool. All right. Just in case you were listening to this episode today and thought, "Oh gosh, I need resources now." That was a lot. Yes, that's totally fine. And that's why it's a podcast. You can always listen to it again and pause and stop and, rewind and do all the things. And thank you so much for being on the show, Jess. It was such a fun time, such a pleasure to hear that side of you today and you educating us about that.
I'm always so excited to talk about it because it is such a mystery around it, and, it's not as bad as everybody thinks, and it doesn't hurt. So I'm glad you were able to share some of that too. It is not painful. One acupuncture needle, well, one regular needle fits about 10 acupuncture needles inside. That's how thin they are. It shouldn't
Mhm.
hurt.
Yeah, no, and I've had it done before. I sometimes I couldn't even feel it. So,
Yeah.
yeah, it's awesome. Thanks y'all for listening. You know what to do. Like, subscribe, share, do all the things. Comment if you have questions. Don't be shy. I'm glad to forward things to Jess and have her answer or, help with certain things. And yeah, I'll see y'all again next week. Thank you so much for being here with me today. Leave a comment, give it a thumbs up, a review, and share it with somebody you think needs this. Have a fabulous day. See you next time.